Welcome to Utah Hair Restoration, and thank you for coming in for a consultation. We understand that you are a woman that may be losing your hair. Hair loss in a woman can be a particularly devastating condition, and I wanted to take a few minutes to address some of the diagnostic criteria for female pattern alopecia and treatment options that are available. First off, when evaluating a woman for hair loss, it's especially important to provide diagnostic material or information, in other words, what's causing your hair loss. In contrast to men, where almost all hair loss in men is androgenic alopecia or genetic hair loss, in women there are many other causes of hair loss. The first and most important aspect of an evaluation for female hair loss is recognizing and understanding different patterns of loss that can be seen in different causes of that hair loss. Again, the most common type of hair loss in a woman is androgenic alopecia. Generally, this has a characteristic pattern of what we call a Christmas tree pattern, where the frontal hairline maintains its location. It doesn't recede like it does in a man, but hair will thin across the whole top of the head. It looks like the parting of the base of a Christmas tree, where it looks wider and wider at the part as a woman continues to lose her hair. However, the base of the tree maintains its normal position. It can thin, but again, doesn't recede as it does in a man. The sides and back of the head can also thin, especially in advanced androgenic alopecia in a woman. Doesn't maintain thickness and coarseness like typically happens in a man. So again, this is the most common pattern of hair loss in a woman and is consistent with androgenic alopecia. Diffuse loss, where hair loss is seen from the front all the way to the back, can be seen in severe cases of anemia, where the iron levels or the blood levels can be decreased. There are some simple blood tests that can check for this. Abnormal testosterone and estrogen levels can cause male pattern of loss, where they actually will develop recession, especially in the temples and across the frontal hairline. There are inflammatory conditions that are more common in women than they are in men and certainly need to be considered. Examples include alopecia areata, alopecia totalis, frontal fibrosing alopecia, triangular alopecia, lichen planopilaris. Again, all inflammatory conditions that can cause oftentimes severe and dramatic hair loss in a woman. These can be tested for with simple blood tests, but oftentimes we'll need a punch biopsy of some of the affected hair follicles looked at by a pathologist to understand the inflammatory condition that's leading to the hair loss. Again, understanding and recognizing patterns of loss is the most important part of diagnosing the underlying cause in female pattern alopecia. During my evaluation of your hair loss, we may ask that blood tests be run, and possibly a punch biopsy may be necessary to diagnose your cause of hair loss. Sometimes insurance will get involved, as this is a medical cause of hair loss, not genetically induced. Once we've made a diagnosis and determined the underlying cause of your hair loss, we can then proceed to different treatment options. Sometimes treatment simply involves the correction of the underlying medical condition causing the hair loss. Some of the inflammatory conditions causing hair loss, including lichen planopilaris, triangular alopecia, frontal fibrosing alopecia that I've mentioned previously, often require a referral to a dermatologist in order to treat the underlying condition. Again, once I come in, evaluate your hair loss, recommend possible diagnostic tests, then we can talk about the treatment options. But your treatment may or may not involve additional medical practitioners to assist in your care. If we have determined that the cause of your hair loss is genetic alopecia, which again is the majority of female pattern hair loss, then there are treatment options available to you. Let me talk a little bit about medical therapy for female pattern alopecia versus surgical therapy, and when I come in to evaluate you, we can talk about the options that are best for you. First off, medical therapy is primarily designed to help and assist with the existing hair that you still have, both from a maintenance and keeping everything that you have, but also providing some additional fullness or body to the existing hair loss. Minoxidil or Rogaine is an effective treatment for female pattern alopecia, similar to what it is for men. The way that Rogaine works is it helps to thicken or coarsen the existing hair that you have. Again, when a woman is losing her hair is not only decreasing in density or hairs per square centimeter, but the volume or coarseness of each individual hair tends to thin. Rogaine works by thickening or coarsening the existing hair that you have. Generally, what I recommend for female pattern alopecia is that you use 5% Rogaine once a day, done at night. One of the complaints that we have about Rogaine is that it has an oily or greasy consistency to it, and that limits your ability to use it during the day because it makes it hard to style your hair in the way that you want. So again, using 5% minoxidil or Rogaine done at night before you go to bed, wake up in the morning, shower it out, and don't reapply until the following evening is the best way to gain some benefit, but at the same time be able to style your hair in the way that you want. The second medical therapy that I typically recommend is something called low-level laser therapy. Low-level laser therapy has been around for over a century. It was used in the early days of World War I for burn victims, where laser therapy helped to treat the skin, prevent infections. This has been studied by the FDA, and there are FDA-approved low-level laser therapy devices. We use a device called Capillus. Capillus has been FDA approved, and it's effective at increasing the body, volume, fullness, and preserving your hair from continuing to fall out. The Capillus device that we offer in our office is a baseball cap that you put on the top of your head. There's diodes inside the baseball cap, 272 diodes per baseball cap, and if used properly, the studies have shown nice benefit, especially in preserving the existing hair that you have. I want to talk just briefly about the progression of loss that happens in female pattern alopecia. Unfortunately, you're here and you may have female pattern alopecia or genetic alopecia, and the progression is extremely variable. There are some patients who will sit stable with the same amount of hair loss that they have for many, many months or years even, where their hair loss doesn't progress. There are other patients where their hair loss progresses quite rapidly and unexpectedly to the point where they can be practically bald on the top of their head. I wish I had a more firm answer for you, but unfortunately, with genetic alopecia in women, the progression pattern is extremely variable. The incidence of hair loss tends to group in a bimodal fashion, meaning that the incidence will oftentimes be first seen in the decade of the 20s. This is often related to childbearing years. The second incidence of hair loss in genetic alopecia in women is in the decade of the 50s, and again is often associated with hormonal changes associated with menopause. There is hope. Surgical hair restoration in women is a very nice option to restore some of the hair loss that you may be experiencing. Surgical hair restoration is most commonly used for genetic alopecia. However, it can also be effective in non-genetic causes of hair loss. When I come in to evaluate you, we'll talk about when and how a hair transplant can be effective depending on the pattern or cause of your hair loss. With surgical hair restoration, the underlying principle is that hair is taken from one location and moved to a new location. When you move hair from one location to a new location, the hair doesn't know that it's changed places. It keeps the same characteristics that it had in the place where it came from. So hair from the back of the head transplanted to a new place on the head will grow just like it did in the back. It would grow long all the way down to your belly button if you left it alone. This characteristic is called donor dominance, where again the hair doesn't know that it's changed places and continues with the same growth characteristics that it had in the location that it came from. We use this characteristic that hair has to move it into a new location where it will provide an aesthetic benefit to your face. During female pattern alopecia or genetic alopecia, we'll transplant typically into the part itself and along the frontal hairline. This reverses the Christmas tree pattern of loss, where the part is getting wider and wider by packing hair into the part itself. Again, this helps to disguise the widening that tends to happen with female pattern alopecia. This is a surgical procedure performed in our Quad ASF certified operating room. You're sedated for the first 2 to 3 hours of the surgery. Hair's taken from the back, cut up into small individual grafts, and placed into recipient sites on the front of the head. The hair does take some time to grow. It can take up to an entire year before it grows, particularly in women where it has to grow to full length to match the adjacent hair. When I come in to evaluate you, we'll talk about your pattern of loss, discuss some of the diagnostic modalities to help understand what's causing your hair loss. We may recommend referral to a dermatologist or an endocrinologist, and we'll talk about treatment options up to and including surgery.